Can you hear me?
Tax reform. I'm just kidding.
Can everyone hear me? What are John's?
You probably should have.
Policy Institute.
Okay.
Welcome to this afternoon's briefing on health challenges facing women veterans following deployment. For more than a decade, we have sponsored an annual event honoring women veterans, and we plan on continuing this tradition for many years to come.
Sorry, I just want to applaud that. I support it.
And I think it's almost 15 years. I tried to pinpoint it. It's 14, I think, so we're close to
right.
15. The Women's Congressional Policy Institute, or WCPI, as many of you know, is a nonpartisan, nonprofit public policy organization. And our mission is to bring women policymakers together across party lines to advance issues affecting women and their families. And we work closely with members and staff of the Congressional Caucus for Women's Issues. And I would like to first thank our congressional briefing co-sponsors, Congresswoman Susan Brooks and Lois Frankel, co-chairs of the Women's Caucus, and Congresswomen Mimi Walters and Brenda Lawrence, vice chairs of the caucus. This is the 14th briefing in a women's health series we are sponsoring over several years, underwritten by the Robert Wood Johnson Foundation. We thank the foundation for its support and its work to improve the health and health care for all Americans through its support for research and programs working to help build a national culture of health. Our thanks to our partners in this event, DAV, Disabled American Veterans, and the Iraq and Afghanistan Veterans of America, IAVA. Both organizations have made women veterans a priority in their advocacy efforts, and we are very grateful for their important contributions. And we welcome our speakers, who will be introduced in just a moment, Dr. Carolyn Clancy, Sharonda Love, and Allison Jaslow. And I will introduce them as soon as our member of Congress speaks. I would also like to acknowledge Betty Mosley Brown, Associate Director of the Center for Women Veterans. Betty, where are you? There she is. And seated right next to her, Dennis May, Deputy Director of the Center for Minority Veterans. And I believe the only board member that I see here yet is Anna Schneider of Volkswagen. Welcome. Have I missed anybody else? WCPI board? Okay, I didn't think so. Very importantly, would anyone who is currently serving in the military or all veterans please stand? Woohoo! Awesome. We thank you for your service and for joining us today. This briefing is being videotaped and should be available later this week at our website, womenspolicy.org. And so please invite colleagues, friends to view this event if they weren't able to join you. And we also will be live tweeting today's briefing, and we encourage you and others to do so using the hashtag WCPIHealth. And now, without further ado, I'm very pleased to introduce Congresswoman Cheri Bustos, who is serving her third term representing the 17th District of Illinois. Congresswoman Bustos currently serves on the Agriculture and Transportation and Infrastructure Committees. As everyone here knows, she has been a strong advocate for veterans and ensuring their timely access to health care and benefits.
Good afternoon, everyone. How's the salmon? Allison Jaslow, to my far right, said in her travels she doesn't often get salmon. So this is a special day. I am Cheri Bustos, and I represent the northwestern part of the state of Illinois. And I have almost a constituent who lives just outside of my district right here with Becky. But I just really, more than anything, want to say welcome. The Women's Congressional Policy Institute is truly one of those organizations that brings not only women together, but women Republicans and women Democrats together. And there is not a whole lot in Washington that facilitates a bipartisan effort. And it is also, so it is that, and it's also veterans that are a common denominator for us. We believe in our hearts and in our souls in making sure that we do everything we can to be helpful to our veterans, because to all of those of you who stood just now when Cindy introduced the veterans, we owe you a great deal. And more than anything, want to say thank you to each and every one of you who have served, who have given us the opportunity to be able to serve in a democracy. So thanks to you. And then also, I just want to do one special shout out to Allison Jaslow. She is the executive director of the Iraq-Afghanistan Veterans of America, but she also used to be my boss. She was my campaign manager in my very first race that without her, I would never be able to stand up here as a member of Congress. She literally helped shepherd the way in a very, very tough first race for us. I'm now in my third term, will be running for my fourth term. And then after she helped with our success in being elected, she was then my chief of staff before she left and now is running the Iraq-Afghanistan Veterans of America. She can tell you a little bit about her own background, but she was a captain in the Army, served 2 tours in Iraq, and is really, Allison, you are one of my heroes and one of my husband's heroes because of everything that she has done, not just for us personally, but also for our country. So with that, Cindy, I'll turn it back to you. I think you're doing the introductions of our speakers today. But welcome to everybody, and again, thank you very much to our veterans and for all you've done for our country.
Thank you so much, Congresswoman Bustos, and it's a pleasure to work with you on a wide range of issues, not just women veterans issues, but thank you for all of your contributions. We are going to start first with Dr. Carolyn Clancy, the executive in charge for the Veterans Health Administration, with the authority to perform the functions and duties of the Undersecretary for Health. A highly experienced and nationally recognized physician executive, Dr. Clancy directs a healthcare system with an annual budget of approximately $68 billion, overseeing the delivery of care to more than 9 million enrolled veterans. Dr. Clancy previously served as the interim Undersecretary for Health and as Deputy Undersecretary for Health for Organizational Excellence. She also served as the Director of the Agency for Healthcare Research and Quality. In 2015, Dr. Clancy was selected as the Outstanding Federal Executive of the Year by Disabled American Veterans.
Good afternoon, everyone, and thank you so much, Cindy. It is such a pleasure to be here today, and Congresswoman Bustos, wow. I should have known you had a very tight connection with such a fantastic woman and a woman veteran on top of it. It is really a pleasure to be here this afternoon to talk to you about VA's progress in meeting the unique needs of our women's veterans. I want to thank Cindy Hall and the Women's Congressional Policy Institute for inviting me and sponsoring this briefing in conjunction with the Congressional Caucus for Women's Issues. I had the privilege of speaking here some years ago, and I've just been dying for an invitation back, so here I am. And I really, really want to thank my colleagues from DAV and Iraq and Afghanistan Veterans of America for co-sponsoring this. They have been there every time on behalf of women veterans, and we really appreciate that. It's really, really great to be back with you. We've made tremendous strides in expanding services and access for the women veterans we serve. All VA medical centers now have primary care providers trained to care for women. Now, for those of you who think, well, duh, I will say as a female primary care provider, that has not always been a given, not just in VA, but elsewhere in terms of the being trained to care for women part, so that's a big deal. But first, let me say that many women veterans are coming to care, many more, than ever before, and they're now the fastest growing population that we have. In 2000, just to give you some big numbers here, about 159,000 women veterans received care and services in our system. By 2015, that was 439,000, and currently that's more than 700,000 women veterans enrolled in our system. So we're thrilled and are stepping up to the challenge, and it's why meeting the needs of women veterans is a big priority for us. We have made strides, as I said, and 90% of our outpatient clinics, that is a lot of outpatient clinics, actually have providers specifically trained to take care of women patients. We're now offering digital mammography at 60 sites around the country and more coming, and gynecology services on site at 130 VA medical centers. I can tell you, having worked at HHS and visited some VAs maybe a dozen years ago, it is really a new day. The notion then of having gynecology on site, even for some of the larger VA medical centers, would have been like, no, that's not actually part of the package. So really, it's been with our partners and frankly with and for our women veterans that this progress has been possible. We have a new benefit recently for in vitro fertilization, and this was implemented for seriously injured veterans and their spouses. And some veterans are now receiving this service. We also look regularly at quality by gender. By the way, when I was at ARC, we tried to get a health plan and a group that accredits health plans to do this as a project. And in my simple-minded way, I thought they would do the project and then do it forever. I'll just say they did the project. It did not lead to an ongoing assessment, but we are doing that on an ongoing way. On some of our important quality measures, including breast and cervical cancer screening, VA outperforms Medicare, Medicaid, and the private sector. In May of this year, we announced the VA will follow the American Cancer Society's recommendations for breast cancer screening. And we've deployed large-scale initiatives to train more than 3,100 VA physicians on women's health core curricula and priority topics. We've also worked to address the issue of longer wait times for primary care appointments for women veterans in our healthcare system. Can anyone tell me why some of the wait times are longer, or why women might have more trouble with access? Not enough providers is one, and that's true for women and men, and also child care and other responsibilities. So what we have seen since the onset of the access crisis several years ago is, this is rocket science, so please take notes. If you offer extended hours, that will actually help quite a bit. We have 4 facilities that actually have child care on site, which makes a very big difference. Incredibly enough, we don't have the authority to do it elsewhere, but almost all of our facility directors would love to offer this because they recognize how important it is to the women that we serve. So initially during our access crisis, we found that women were waiting longer. That is no longer true. In fact, the statistics, which are checked regularly, look a little bit better for women than men, and we assess these on a regular basis. And on top of that, we're closely watching and working with facilities with long wait times for women and work very closely with them to pinpoint the problems and help them find solutions. Now, what do I mean by solutions? Well, that might sound like solutions equals pull your socks up. That's part of it. Some of it is about using telehealth. How many of you actually have ever done this with a health plan or provider? Good. You know, some people I work with, also women, as it turns out, were telling me about calling Kaiser around here locally a few years ago. Was feeling really awful and talked to a nurse on a telephone line who said, gosh, would you like to talk to one of our nurse practitioners right now by video? And she said, well, yeah, sure, that'd be great. And they emailed her the app, and in 5 minutes she was online with a nurse practitioner who could see her and ask her some more questions and said, I think you're right. you have the flu, you really don't need to come to any ER or waiting room and give it to other people. And you're going to be miserable for a few days, but you will get better. And if you want a prescription for Tamiflu, which some people like to help lessen the symptoms, we can get that for you now. That's where we're heading in VA, and I think it's going to make a huge amount of difference. I know this because I'm the oldest of a large family, and when I was a kid, we didn't have a car at home during the day. So I'll just say my mother and the pediatrician were truly co-producers in the production of our health. And telehealth would have made a huge, huge difference. Telehealth then, of course, was the phone, which still works, but even better when you can see the person who's really feeling terrible. I mentioned extended and weekend clinic hours, and also for some obvious reasons, not the least of which is we do not have maternity services. Our women veterans are the biggest customers of our Care in the Community program. This is where we work with providers who see patients in the community, and actually they work for VA and see veterans, but we are responsible for making sure that that care is coordinated and that veterans get the kind of continuity that they need. We're building an efficient network of VA and community providers that will bring care to veterans when and where they need it, because we want those experiences to be seamless when they receive care, whether that's at one of our facilities or in the community. So we're developing a program that's easy to understand, simple to administer, and meets the needs of veterans. That is the Holy Grail. I hope you heard how simple that sounds. It's not quite that simple in real life, but that is our aspiration, and we won't stop until we achieve that. The community care program, very importantly, is being developed with the participation and support of our partners in Congress, veterans service organizations, and other stakeholders. One issue that we're very, very troubled by that I wanted to put on your radar screens as well, because it is a national public health emergency, and that is suicide. We have seen increasing rates of suicide in veterans compared with the general public. We know that on average 20 veterans suicide every day, which is way, way, way too many. We also know that 6 of those veterans get care in our system, and their rates of suicide are lower, which says to us that identification of potential warning signs and treatment can be effective. But we are also responsible for the other 14. So for those of you who know veterans or anyone else who might be distressed, the only mistake you can raise in having this conversation is not starting it. Please don't ever forget that, because in addition to the fact that this is a big, big issue for veterans, it's a big, big issue for Americans, because we've seen this rate increase. Suicide prevention is, in fact, our top clinical priority, which means that all 300,000 plus employees in our health system have been trained in suicide prevention techniques. And a lot of this is about being there. Being there if someone feels sad or distressed, or in some way gives you a signal that things are not going well for them. And we're particularly concerned for female veterans because they die by suicide at more than twice the rate of female civilians. So more than 430,000 current women veterans are currently receiving care in the VA system, and almost half, 42%, are using mental health services. That, in my view, is a sign of strength, not a sign of weakness. And we know in healthcare generally women tend to step forward with less reluctance than men about these issues. But again, if you know women veterans who you think could benefit from that help, please encourage them, because we are here with open arms and can see people on the same day if needed. We also have a lot of programs that help veterans with post-traumatic stress disorder, substance use, depression, and homelessness. Many facilities provide this specialty care through women-only outpatient teams, which we think is a very, very important problem. We also have residential programs for those women veterans who need more intensive treatments. We have, not surprisingly, universal screening programs for common mental health conditions and related experiences, including those that are associated with an increased risk for suicide. These screenings actually help us identify veterans most in need so that we can step up and help. That's really what it is all about. Our screening rates for these disorders are very, very high, exceed private sector rates in general, and don't differ significantly by gender. One of our most important resources for suicide prevention is the Veterans Crisis Line. So this is 800-273-8255. And I will write it down again, tell you again so you can write it down. 800-273-8255. Several years ago, when I had the privilege of serving as I am now as Acting Undersecretary for Health, I got a lot of cries for help by email and other means. Sometimes that was from the individual themselves. Sometimes it was someone emailing me that I saw something very worrisome on my Facebook. I don't know this person, but can you help? And I was amazed and inspired by how often we could help, which was the vast majority of the time, through online connections and contacts in local areas who could reach out to those veterans. If you call any of our facilities, now, it would be lovely if you got a warm human immediately, but as you know, that often doesn't happen. But the automatic answering says, if you have an immediate emergency, you know, call 911. We can't help you instantaneously. But if you are having thoughts of harming yourself or are in crisis, press 7. You don't even have to dial. You just get connected through directly. Every one of our facilities has a suicide prevention coordinator. And we've got a lot of strong training programs for all of our clinicians. One of the things that we do in VA, and I'd never heard about this until I joined VA several years ago, is we have what are called mini residencies. Now, you know, the regular residencies are like 3 to 5 years long, and they're not mini at all. This would be more like a 4 to 6 week experience, so you can get intensive training in a particular area. And one of the things that we've been doing recently are women's mental health mini residencies, so that we can bring people in around the country to be together and actually be trained together, and so that they can go back refreshed with the latest knowledge and skills to be able to assist women veterans. We also offer free counseling and treatment for both mental and physical health conditions related to military sexual trauma. Veterans and service members do not need to have reported that experience to authorities, and they don't need documentation of it to receive care. I want to say that again because I think it's hugely important. You don't have to have reported it, and you don't need documentation to receive care. We are there to help. We offer a wide range of mental health and medical services for MST, again, including outpatient and inpatient treatments. And every facility has a military sexual trauma coordinator who can help connect veterans and service members with our programs and services. Again, veterans can receive that care even if they're not enrolled in our system or aren't otherwise eligible. This is just no wrong door for that particular set of issues. And they do not need to be service connected to get this care. Over the years, many women veterans have reported feeling invisible and unrecognized, not only in their communities, but in our facilities. And in fact, in the very early days of our stepping up to understanding that we were serving not just the occasional woman veteran, but this was going to be part of our usual business and that we needed to be prepared for that. Occasionally, women would find themselves, for example, in a mental health group with all men. So imagine if you had experienced and maybe not even shared that you'd had military sexual trauma. You can imagine how traumatizing this would be. So we are doing everything we can to make sure that those experiences aren't repeated. We want all women in our country who've served our country in uniform to be honored and have access to timely, high-quality, respectful health care. We know that truly honoring women veterans starts with a culture that promotes equality and recognizes their service and sacrifice. We're not complete, we're not done yet. but we're making steady progress towards cultivating an inclusive and welcoming environment for our women veterans. We hope all women who've served are proud to call themselves veterans. We're very, very proud of their service and to know that VA is here for them. So thank you for the opportunity to be here today. It is truly an honor, and thank you, Congresswoman, for helping to launch this today.
Thank you so much, Dr. Clancy. We appreciate a wonderful outline of so much that's happening. Things have really improved. Thank you again, Congresswoman Bustos, for your support, and we appreciate your hard work on these issues. I also want to acknowledge Ambassador and former Congresswoman Connie Morella has joined us. She's also on our board, one of our founding board members. Our second speaker will be Sharonda Love, Assistant National Legislative Director for Disabled American Veterans, or DAV. She is a service-connected disabled veteran who was appointed to her position in August of 2015. In this capacity, Ms. Love works to support and advance federal legislative goals and policies of the nearly 1.3 million member DAV to assist disabled veterans and their families and to guard current benefits and services for veterans from legislative erosion. Prior to her current position, Ms. Love served in several professional positions for DAV national service offices in Alabama, Utah, and Louisiana.
Thank you, Cindy. Good afternoon. I want to first start by thanking the Women's Congressional Policy Institute, the Robert Wood Johnson Foundation, and the Congressional Caucus for Women Issues for this awesome opportunity to speak to you today. It is always a privilege to stand before you to discuss the needs of women veterans. On behalf of our adjutant, Mr. Mark Burgess, our commander, Miss Delphine Metcalf Foster, and our 1.3 million members, good afternoon. I was asked to speak to you a little bit about who DAV is and what we do, and also cover a few women veterans issues. I would like to begin with who we are and what we do. DAV is a veteran service organization that was chartered by Congress in June 17, 1932. We are a membership-based organization comprised, as Cindy said, 1.3 million veterans, service-disabled veterans. DAV is a nonprofit charity that provides a lifetime of service and support to veterans of all eras by providing claims assistance, employment assistance, transportation to and from VA hospital appointments through our transportation network, and by helping veterans gain access to health care and other benefits and services that are offered by the VA. Our national service officers are simply veterans helping veterans. Therefore, we are able to form relationships of trust and understanding through a lifetime of mutual experiences, both during and after military service, that aid in our connection with our comrades as we provide them with free professional advice on the claims, appeals process, and benefits that VA offers. Yearly, DAV has helped veterans file more than 300,000 claims for benefits. In 2016 alone, our service officers helped veterans and their families obtain more than $4 billion in retroactive benefits and new benefits. Not only does DAV stand out in front, navigating the appeals and claims process, we also lead the way in advocating for the rights and benefits of service-disabled veterans and bringing to the forefront the disparity in the care and services available to women veterans in comparison with that of their male counterparts. Our leadership continues to be forward-leaning, recognizing the unique needs of women veterans and the challenges that they face as they attempt to navigate for benefits and services in healthcare in equity to that provided to male veterans. For more about DAV, please visit our website, www.dav.org. While you're there, be sure to visit our Commanders Action Network. Here, you're able to sign up to become a part of our grassroots efforts and receive or respond to notifications about bills that DAV is tracking or other bills that you may be interested in. www.dav.org is your one-stop shop for all things DAV. Now, let's jump into the conversation on women veterans healthcare. This is an opportunity for us to have open and honest dialogue about the issues or barriers that women veterans face and determine where we are and where we need to be to ensure women veterans receive the benefits and services and health care in equity as their male counterparts. One reason for the inequity as the male counterparts is their rapid growth, as Dr. Clancy mentioned. From 2005 to 2015, the number of women veterans enrolled in VA healthcare increased to more than 83%. During the same time span, the number of women veterans using VA healthcare also increased from more than 237,000 to over 455,000. Their rapid growth has helped to make it difficult for VA, an administration that has traditionally served predominantly male veterans, to not only transform itself to prepare for a different type of patient, but also change its culture and do so in concert with reorganizing the way that it does business. These factors have, among others, have combined in making it challenging for women veterans to receive gender-specific care that they need, which is unlike the experience of male veterans. The challenges women veterans face range from not having enough primary care physicians trained on their needs to the availability of gender-specific or sex-specific care at the nearest facility to them. And finally, having facilities that are appropriately staffed and equipped to provide all of the services that they may require. DAV's 2014 report, Women Veterans, The Long Journey Home, highlighted 27 recommendations geared at improving services afforded to women veterans across the federal landscape. Many of these recommendations are still valid today. At our most recent national convention, we had the opportunity of conducting focus groups. Many focus groups pointed out experiencing some difficulty at some VA facilities in seeing a gynecologist, a VA gynecologist. They report that often the gynecologist is available on certain days, making it difficult to obtain an appointment. DAV understands that every VA medical center may not need to have a full-time gynecologist on staff. However, we do expect that these facilities without these specialists have a plan in action that is readily accessible to seamlessly provide women presenting with the need to be seen by the specialist in a timely manner. Gender or sex-specific care is not limited to gynecology or mammography, but also it includes primary care. Women's health, as Dr. Clancy pointed out, primary care physicians should be especially trained in the care of women to include the ability to conduct basic examinations, perform breast examinations, cervical cancer screenings, contraceptive medication management, and menopause management. Based on the GAO report, GAO 17-52, dated December of 2016, VA was short 675 health primary care providers. We are counting on Congress to continue to help VA close this gap. Congress and the President must ensure that VA have the necessary resources it needs to continue to provide high-quality care to all veterans and ensure veterans' care is on par with that of male veterans. We acknowledge the many improvements in support of VA women's health that VA has made, and the introduction of key legislation made by our congressional leaders, and the implementation of new programs and services aimed at improving women's health care. However, we emphasize it is an all hands on deck. We call on VA and Congress to continue to make our health care a priority, keep our needs up front as the blueprints are being developed, and ensure that we do not become an afterthought. And also, when legislation is being introduced, see it all the way through to the President's desk. Another participant from one of our focus groups stated that she felt that by not having access to gender-specific care within VA, it made her feel as if she was not important as male veterans. She noted that her husband, in most cases, was able to obtain all of the care in one day at one facility, whereas this was simply not her plight. And sometimes her visit could be spread out into as much as three days at different facilities. This type of care then becomes a barrier to care for working women veterans. Some women veterans' feeling or perception of not being as important as their male counterpart goes in hand with reoccurring conversations of women's lack of identifying with their service, and society's perception of what a veteran is. Often women veterans' experience is different from that of their male counterparts. During this same focus group, several women indicated that they felt that their military service was not seen as valuable to society as that of their male counterparts. It was also stated that male veterans seemed to be praised for their service and were seen as heroes, where women are sometimes criticized and made to feel ashamed of joining the military and or for leaving their children and families behind while serving. Despite the fact that men and women have been a part of the military since its inception, more officially dating back to the early 1900s, many within society failed to acknowledge women as veterans. In a survey conducted by SWAN, the Service Women's Action Network, out of 1,000 respondents, 74% believe that their service isn't publicly recognized. In direct correlation with this fact, each year many women report being overlooked on Veterans Day. As America pays the respects to its fallen comrades for all wars and thanks its veterans, some women report even while being dressed in t-shirts and wearing hats signifying their military service, they are asked if they wear them in honor of their husband or their male relative. Let's do our part to bring about a new experience for these women right now. At this time, if you're a woman that has served, regardless of the branch, please raise your hand. Thank you for your service. And from me to you, I want to let you know that you are appreciated and you are not alone. If you are having problems connecting with other women's veterans, please see me after this presentation. Are there any male veterans that have served? Prior to my acknowledgement, you experienced what women veterans experience year after year, being left out. So I now charge you with aiding and ending this lack of acknowledgement by helping ask the question for your fellow comrades and remembering to thank them for their service. I am happy to say that Congress and VA have taken many steps in the right direction to address the needs of women veterans. However, more steps should be taken until we cross the finish line. Until all women veterans are receiving all of the health care and benefits and services in equity of that of male veterans. Thank you.
Thank you so much, Sharonda. As always, it's a pleasure to have you here, and we appreciate pointing out many of the issues that we've actually heard over a number of years at this event. And certainly some things have improved, and certainly Dr. Clancy concedes that there's much more to be done. But thank you for sharing those many observations, very valuable. Our final speaker is Allison Jaslow, Executive Director of the Iraq and Afghanistan Veterans of America, IAVA. In this role, Ms. Jaslow focuses on policy, external communications, IAVA's Washington, D.C. operations, and is the primary spokesman for the organization's groundbreaking #SheWhoBornTheBattle campaign and other policy initiatives. Ms. Jaslow is a former Army captain who served 2 combat deployments in Iraq. She is one of the nation's leading voices and advocates for post-9/11 veterans, and previously served as IAVA's Chief of Staff and Director of Intergovernmental and Political Affairs. And as we heard from Congresswoman Bustos, prior to her career at IAVA, She was a successful campaign manager and respected political and communications strategist.
Thank you for the kind introduction. Are we expecting more members of Congress? Do I have to?
You are fine. We may have one or two about 1 o'clock.
Okay. I'm going to do my best to keep it short because I also hope that we can engage everyone here in a dialogue as the coffee gets passed around. Thanks, first of all, not only to the Bipartisan Women's Caucus and Women's Inc. for hosting this. I think it's a thrill that they recognize women veterans every year. Thanks to the members of Congress, past and present, who are attending and will be cycling through. Ms. Clancy, the incredible work that you do and the intestinal fortitude that it takes to do it inside a government agency should definitely get a round of applause, so please. Our women veterans not only count on having advocates like myself and those over at organizations like the DAV, which has been beating the drum on women veterans for years on the outside, but we definitely count on women from the inside advocating for us as well. A quick plug about Iraq and Afghanistan Veterans of America. We are the leading voice of the post 9/11 generation of veterans. We are over 400,000 members strong. And I consider it the privilege of my lifetime to be here and not only advocating from a leadership role in the organization, but to also say that women veterans are our top priority this year. I don't know if there's any other organization out there, while many have prioritized women veterans, that are willing to make them number one. And I'm certainly proud of that fact, and tell all your friends that IAVA is out there doing that, please. When I spoke to this organization last year, I believe it was just after Veterans Day, right, Cindy? So I'm thrilled to get in front of everybody before you go out to your Veterans Day activities back at home this year. Since last year, we actually launched, as Cindy said, our hashtag #SheWhoMournedTheBattle campaign. And why did we do that? As the two women who preceded me stated, the VA in America have come a long way. We've made a lot of progress as it relates to caring better for women veterans. But we believe that we haven't come far enough, quick enough. And so we wanted to put some rocket fuel into that. And that's not just because people need to know more about alarming statistics like the fact that women veterans are dying by suicide at 250% the rate of civilian women. Or that 1 out of 4 women who are enrolling in the VA are saying that they've experienced military sexual trauma. And that's not just because we need to fill gaps in care like the one detailed in the DAV's wonderful report back in 2014 that said that 1 out of 3 VA facilities don't even have basic care like a gynecologist. I hope that everyone in this room can agree that if we're going to treat all veterans and care for all veterans in the same way, that means that basic services that a man can expect, the same type of basic services unique to a woman, that woman veteran should be able to expect as well. But perhaps most importantly, the reason we launched our She Who Mourned the Battle campaign is because too many women veterans tell us that they feel invisible. In fact, you heard both of the women who preceded me mention that as well. And that's not just at the VA when her civilian husband is instinctively approached to be checked in for his appointment, but it's also in America, where I can tell you I've had to prove my service to the most liberal 30-somethings out there who look at me when I say, yes, I went to Iraq, yes, I went to Iraq twice, that they make me repeat myself one more time and say, shut up. Really? You went to Iraq? I literally did. And that's where I have to stop myself from not having to devolve into some sort of battle scenario and graphic depiction of what it was like. It would be nice if the first time people just believed me. And I get it. There's a list of reasons why Americans don't think of a woman when they think of someone who looks like me. But with your help, I think we can change that. And that's also why IAVA has boldly called for the VA to change its exclusive motto. For those of you who don't know the VA's motto, it's to care for him who shall have borne the battle, and his widow and his orphan. It's on 2 large plaques outside of the VA headquarters. It's on a lot of the presentations inside the VA. And again, I will pat Dr. Clancy on the back for all of the great work that she's done and has talked about specifically addressing the culture at the VA. I think, and it's part of my military background, it says that culture change can only happen from the top. And I think that that starts with the motto. And it might surprise some of you here to learn that there are 2.2 million women veterans in America today. We've actually been serving since Deborah Sampson disguised herself in the American Revolution as a man so she could fight for our independence. So this isn't a new thing, but I'd bet that, you know, I don't know, there's probably only one politician left in the room right now, but if, I know because of my background, when you get together and you put together a commercial shoot, one of the first things your consultants will say when they're going to do the veterans ad, because they all have them, is just make sure we have a lot of men with hats on. And I'm really hopeful, and I know that part of IAVA's campaign is going to accomplish this, is someday political consultants are going to start calling their candidates and saying, make sure you have women there, and I don't care if they have a hat, we're going to trust them. And that they can be seen as veterans too in a campaign mailer. You know, it's this lack of recognition and awareness that I believe that actually truly impacts the type of care and support that women veterans are going to be able to get. It drives the will of the people in this town here to actually improve the services. But the related and persistent cultural barriers are what prevent women from even taking advantage of the services once they're put into place. If you think that you're going to have an experience like I did when I got out of the Army and I enrolled at the National Capital VA here in town and was asked, you know, directions as though I was a physician there by an older Vietnam, probably era veteran, and looked at him and saw the look of disappointment in his face when he realized that I, too, was actually a patient and just as lost as he was as well. But, you know, it's stories like that. It's stories like the woman whose husband was approached that actually, I think, turn a lot of women away and make them feel like, hey, they don't have my docs there. If even the folks who are staffing the front desk aren't going to believe that I'm a veteran, like, why bother? You know, sadly, we've been at war for 16 years. Nearly 200 women have actually died in combat. They're in the infantry and they're graduating from Ranger School, but when they come home, they're fading into the crowds. And they often don't feel welcome, even at their own local VA. Since 9/11, over 700,000 women have served. Nearly 350,000 have deployed in support of combat operations. Demand for VA services among women since 2003 has increased 80%. But still, in our recent survey of our members, which I've noticed you passed out a lot of that great data, you'll note on there that only 27% of IAVA women said they feel like the public respects their service. So while the landscape and the population of veterans has drastically changed, America and VA culture hasn't caught up. And we need to address that. And I'm asking you to make sure that you prioritize that this Veterans Day. And since I'm getting to you before that, for those of you who are elevating our voices here in Washington in whatever capacity and roles that you have, thank you. Keep doing it. Without having you lift us up, there's no way that we'll actually get there, but also help elevate us in your communities as well. The first step to greater recognition is greater awareness. And better recognition will also come, and I want you to join me in our call from being recognized in basic ways by having the VA itself recognize us in its own motto. It's a really simple but meaningful action that we believe can be taken. And until we literally change the way America sees its veterans, we can't truly get the recognition, care, and support that we deserve. Hopefully that was a simple message for you all to take back. thank you for actually prioritizing your time in a way that celebrates women veterans by being here today. And I look forward to having a robust dialogue going forward. Thank you, Cindy.
Thank you so much, Allison. It's a pleasure to have these two women veterans with us today, and those of you in the audience too. And we really do hope that one of these events, we're going to be able to talk about the fact that women veterans don't feel invisible any longer. Because this is a message we've been hearing for really since we started this series. So really hope that everybody in this room can help. We are expecting Congresswoman Mimi Walters shortly, but we'll go ahead and start with Q&A. And also, I do want to, again, thank Dr. Clancy, too, as Allison and Sharonda both did, for her incredible efforts on behalf of women veterans. It is a tough job you're in, so thank you. We have a microphone. Please make sure that you use it. We're trying to capture the questions on the videotape, and so we'll be bringing it around to anyone with a question or a brief comment. And please give us your affiliation, not just your name. And I think we have to wait for a second.
Did everyone enjoy their fabulous lunch?
And
Congresswoman Bustos wasn't lying. I was thrilled when I walked in and saw salmon here.
That's the
You can
Robert
tell
Wood
women are running
Johnson
it, by the way. They were like,
Foundation,
let's do
too,
something
though.
healthy.
That's right. We want to thank our funder who really prioritizes healthy meals. Well, Congresswoman Morella wanted to say something, right? Why don't you just do it at the podium while we wait for them to... No, you need to do it at the microphone. We won't catch it on the videotape.
In introducing myself as a follower and a fan of Cindy Hall and the Women's Congressional Policy Institute, I'm Connie Morella. I'm sorry I arrived late. I am an ex-con, but very devoted to what's happening in Congress. I thought this was an incredibly good panel, straightforward, factual, and ready to push ahead. So I thank you all very much. I'm very interested in the facet of sexual harassment and depression in terms of women's health, veterans, as well as those who are in the service. I wondered how large a shroud that is placing on the work you do, and whether you are seeing a change, or are you seeing more reporting? I just wondered about your reaction to that.
I was trying to figure out the artful way to put this into my remarks, but thank you for teeing this one up for me, Congresswoman. I think, first of all, I'm probably not the only woman in this room who appreciates that we're having this conversation right now in America on large scale. I'll tell you, as a former woman in uniform and somebody who is now a woman veteran, something I've been struggling with, especially since we launched our campaign last year, is what I feel like is kind of a double standard when it comes to sexual harassment as it relates to women in the military and women veterans. And I say that just because, first of all, like, a lot of us have been dealing with it for like a while. I mean, I'm glad everybody's up in arms about like how sexual harassment shouldn't be tolerated and whatnot. But, I think that if you are a woman in the military, you've heard and had to tolerate things that, can I use semi-graphic language? If you're in the military, you'll stand in formation and you'll hear somebody else talking about private so-and-so being a barracks whore, like that's kind of what they're around for. But that's just something that you kind of go along with as you're a woman in the military. And I think that there are a lot of civilian women who would look at us and say like, well, honey, you knew what you were getting into, right? And so I am very optimistic that we can be swept up in this conversation, because women veterans aren't just invisible, but women in the military are oftentimes like silenced in a way where they don't get the right type of advocacy for these issues. And it's not just like, you don't have to be a victim of military sexual trauma to have somebody run to your aid. We can do a lot of things to just improve the culture, not just for women veterans, but for women in the military who are doing what far fewer than not only their women civilian counterparts, but less than 1% of Americans today are serving in this military, and they deserve the best. Every woman does, and so does every soldier, regardless of gender. Anyway, sorry, I will step off of my soapbox for right now.
So as Allison mentioned, the culture change to me, I mentioned it last time we were together, where I spoke about the suck it up and drive on syndrome that many women face while serving in the military and even afterwards. In order to change culture, we have to first change how we perceive things. And it takes us acknowledging and standing up and saying that we perceive certain actions as being disrespectful or what our experience and our tolerance is. We have to first stand up and say that these are issues. So the culture change doesn't just start at VA. It doesn't just start within the public, but it starts with women veterans standing up and saying, okay, this is where I am, this is what I expect, and demanding that treatment and bringing it to the front. And that's why all of us here in this room and on this panel are here to start to bring about that change.
So we have a lot of research looking at various aspects of military experience and how those differentially impact women and men. I don't know that I have seen it, and I have get a brief on everything research-wise just because I'm really interested. I don't know that I've seen anything about sexual harassment in particular, but listening to Allison in particular, it does make you wonder about how one would measure that or even define it for the purposes of, say, a questionnaire or whatever. But you've actually made me really think, right? How do you separate out what becomes wallpaper, right, from an unacceptable experience? And would people serving versus women veterans versus those who have not had that experience share a common, even definition of what is harassment, which I think is one of the big challenges of this issue in particular, right?
Definitely true.
Hi, I'm Becky Weber, and I belong to the General Federation of Women's Clubs. I'm their national legislation chairman. And as Congresswoman Busto said, I'm from Illinois, and luckily I am out here for meetings at our GFWC headquarters and was able to come to this luncheon. I have personally not had the honor of serving. However, I have been playing taps at military funerals since I was 12, and so that's 45 years. And I now belong to Bugles Across America. And quite honestly, I can't tell you how many times I've had the comment made to me, "Oh, you play taps. Oh, you're a girl. You're a lady." I'm like, "Yes." "Well, how long have you been playing taps?" "Since I was 12. And I mean, so I am so honored to be here and to be able to say thank you for your service to all of these female veterans. But, you know, I have experienced just a little bit, not much, but just a little bit of what you have experienced. So thank you for your service.
Yeah.
Absolutely.
Softball.
Thank you. I'm Sam Denham. I'm from HVAC Minority. And speaking to Allison's point about recognizing women, on my personal Facebook page, I put thank you to all the women and men who have served. And I find every year I do that, I have 5 or 6 more people who do it the following year. So I think it's a good thing maybe to push out for people to do because it does really put them in the forefront. I do have a question for Dr. Clancy. You spoke about women not having access to care because of child care issues. Has the VA considered adopting a child service section that would allow veterans, men and women, to have their children watched for a 2-hour period during their appointments to facilitate more access to care?
I'd have to look into that and be happy to get back to you, Sam, so thank you for the question. All I really know is when I was first briefed about the 4 pilot facilities that we have, what I heard was that almost all of our directors would love to be able to have this authority and would find the money to do it because they recognize how important it is. And frankly, it's convenient, right? I mean, on your way to the appointment, certainly most providers can handle it if you've got some kids with you. I have on occasion advised some of my sisters to bring a kid with them. One, to get very clear post-op recovery information, right? I said, you know, bring the baby because the doctor will have a very clear visual of what recovery means for you, as opposed to someone who does not have a fairly heavy toddler who likes to be carried a lot. We don't have the authority for that right now, but I will check into that. It makes a big, big difference. And frankly, the finding about childcare and other responsibilities competing with women's health needs is not limited to VA. In fact, early on in the HIV epidemic, once we had highly effective treatments, it turned out women were less likely to receive them for a few years, and a lot of that was about the hours the clinics were open. There's an answer to that, and I'm proud that we have stepped up to it at VA.
Can I ask you a question, though, if I'm allowed to ask on the panel? If we've known over time that women care for themselves better if they get child care, and we've been at war for 16 years, and women veterans have been flooding into the veteran population, and this probably predates your time at the VA, I don't know, why wouldn't folks think ahead and understand with that data being publicly available and prepare for that? Like
Some of it is about funky HR rules, and some of which we are working with the Congress on right now, which, by the way, does not just impact extended hours to meet veterans' needs, which I would put at the top of my priority list, but it also impacts our ability to recruit, for example, emergency physicians, because many people who go into emergency medicine like the fact that they can work like 4 12-hour days in a row and then take a few days off, and that doesn't actually match federal work hour rules very well. I mean, you know, really kind of silly stuff like that, but nonetheless, it happens to be very vital in healthcare. So that's a piece of it. Some of it is we weren't being anticipatory enough about access needs in general. I do think that telehealth is a real game changer here. That, and very importantly, and this I give Dr. Shulkin full credit for, which was prioritizing by clinical urgency. The answer to the question of how long is it reasonable to wait for an appointment actually depends on what you need to come in for, right? If you're talking about that procedure that people start getting after age 50, most people are very happy if that's 6 months, even next year. There's no rush for that. If I'm worried and scared right now, 5 minutes is about what I had in mind. So that's why across our system, we have made it possible to get same-day appointments or at least contact and resolution for urgent problems in primary care and mental health, period. Why the healthcare system writ large is not a 24/7 operation would be a longer conversation that I'd be happy to entertain, but I'll just leave it at that for right now.
I too want to respond to that question in regards to the child care portion. It was noted in the 2015 Barriers to Care report as one of the primary contributors to women's not receiving the care that they need. There is legislation that is currently pending, and this is one of my soapbox issues. Each year we have this same bill or some similar bills come up time after time. However, they do not make it to fruition. So we need your help in reaching out to your legislators, your elected officials, in pushing and urging them to take action on these bills. They are there. Please visit the www.dav.org, Commanders Action Network, where you will see a list of those bills that are pending, and you can actually sign up to be a member of the Commanders Action Network and actually reach out to those legislators in pre-filled forms. So help us help women veterans and receive the care that they need.
Other questions? And I do think one of you mentioned that this was something in the HIV timeframe, but it's always when we were trying to get women participating in clinical trials, it was always childcare was the barrier more than anything, and transportation was the other.
Which,
It's,
I mean, like, the American people have every right, like, women veterans aside, to be just so frustrated with, like, bureaucrats or politicians or whoever you want to call them when we have information like they're out there and we're, like, not making the appropriate accommodations. It's just, yeah. I don't know what to say.
Hi, my name's Marty. I'm from Congresswoman Jackie Walorski's office. So it's kind of like a broader question, but we've noticed for PTSD, kind of the vet centers have been real productive in kind of helping with that. So I was wondering what is VA doing kind of to connect those services at the vet centers with those offered through mental health services at like a CBOC or something? And then you can go into how that connects with kind of MST and specific women's groups as well.
So thanks for the question, and I'm really, really glad you answered it. So what I didn't tell you about our system is that we have about 300 vet centers. Now, there happens to be one like right around the corner from my house, which I'm very proud of, fairly nondescript building, but magical things happen in there. They have, the formal name is Readjustment Counseling. Now, there's a compelling title for you. They are open to all veterans. It has nothing to do with whether you're enrolled in our system or not. Families can come by as well. There's counseling, there's group sessions. There's also people who can help you with jobs and have a lot of contacts to be able to do that. These centers also have vans that they send out so folks in the community can avail themselves of services. And in my own county, Montgomery County, as Representative Morello would know so well, they also take advantage of partnerships with like libraries and other public facilities where they will have certain hours and so forth. So a very friendly, welcoming place for all veterans. When they were established, which is around 1969 or 70, this was not a time when many returning veterans wanted to have anything to do with government. So by design, they are separate from and don't share information with our healthcare system unless the individual veteran they're helping is, willing to consent to that and so forth. That said, there's a lot of sharing of skills and information about how we can better help veterans and so forth. So it's a little bit of a line to walk for us in terms of protecting the confidentiality. If you walk in the door of a vet center, what you say here stays here, more or less. I do want, just as a little shout out on their behalf, in Las Vegas and most recently, very sadly, in Texas, the vet centers rose to the challenge and actually had vans on site, and our San Antonio facility also had people on site and available to help people dealing with this incredible tragedy.
Kevin Jackson with the National Association of American Veterans. Just a comment first and then really a question. Over the last probably 20 years, we've seen the women's role change in the service. My 5 deployments to Afghanistan and Iraq, I can remember, early deployments in 2003. It was kind of scorned upon to take a woman on a combat patrol. And then 3 or 4 years later, that changed. And I remember in 2015 in Afghanistan, I was assigning women as combat platoon leaders. So I think we've made a lot of progress. And the change has been good for our service. And you talk about the culture, and I think it definitely ties into that. Curious on have we seen any increase in services or requirement for services with the VA or with some of the changes that have happened over the last couple of years to close some of the gaps that you discussed for women's health care in the clinics?
What we've seen is steady progress in terms of being able to reduce and virtually eliminate access gaps. In terms of quality disparities, very, very few. Obviously, I highlighted a couple of issues unique to women, but whether you're looking at heart disease, diabetes, blood pressure, and so forth, we're seeing modest to no disparities at all by gender. A little bit occasionally by locality, right? Some facilities do better than others, but not a systematic difference associated with gender, which I think is a good thing. I'm curious about your experience, though. What do you think made it so different?
I think what made it so different, looking at the VA, last year we went to a bunch of the different VA hospitals. I think there's maybe some disparity between locations, East Coast versus West Coast. You look at the DC VA clinic here is probably the nicest I've ever seen. Going out to San Francisco, visiting the Women's VA Medical Center there, it's very different, not the same, let's say, quality or services provided. When you look at the women veterans now in the combat rows, I'm always just very interested. Are you seeing more, are there any statistics and data? Are there more mental health issues? Are there any increases or any programs to address, things as a result of more combat rows? That's kind of what I was looking at.
Yeah, so what I think where there's probably been the biggest changes, making sure that access and quality are equitable sort of at a high level makes perfect sense, and frankly, that's good management. I think where we have leaned forward the most, actually, is in mental health services, and frankly, making that part of primary care. And I think my impression is that happened first in the women's clinics, and then now we have it embedded in many primary care teams, heading for all of them.
Hey, Cindy, before you introduce the Congresswoman, did you say you deployed 5 times? Can I?
Wow, I missed that.
I'm a firm believer one of the reasons why you saw people embracing women is because not enough people were stepping up. People like yourself have served and deployed 5 times. And I think, we have embraced, maybe many men in the military embraced women reluctantly, but in part just because there are women who are stepping up to do what a whole lot of American men aren't right now. But hats off to you for carrying so much of a load yourself. Thank you.
Thank you, Allison, I missed that. Thank you. We're very privileged to have Congresswoman Mimi Walters, who's the Republican Vice Chair of the Women's Caucus, join us. She represents the 45th District of California and serves on the Energy and Commerce Committee. The Congresswoman is a daughter of a Marine and has been an advocate for modernizing the GI Bill and improving services for veterans at VA healthcare centers.
Well, thank you, everyone. I'm sort of in between meetings and getting ready to go vote, but first of all, I want to say thank you to all of you who serve our country and protect our freedoms. We are grateful for you willing to sacrifice your life for us, and I don't think that there's a higher calling, so thank you so much. And I got elected to Congress in 2014 along with Martha McSally, and many of you know Martha, right? She's about this tall, and she's the first female fighter pilot in combat, and I'll tell you something about Martha McSally: you don't mess with her. She might be little, but she's mighty. And I've gotten to know her quite well, and she really is a great lady. But I know we're coming upon Veterans Day to celebrate Veterans Day. I'll be going back to my district and doing events, and really appreciate all of you coming out here and sharing your thoughts and concerns and what we can do to better support you, especially when it comes to your health care while you're serving in the military. And really appreciate everything you do. So thank you so much for all you do for us.
Thank you so much, Congresswoman Walters. It's tough when votes are literally imminent, and we appreciate your running in. Thank you so much. We have time for some more questions, if anyone, or comments. I have to just note that anytime you have an event, this event specifically, always goes on time so much better than other events. The speakers stay within their time limits. I wonder what that could be.
Way in the back.
Hi. Hi, my name is Mallory Schwartz, and I'm with the American Congress of Obstetricians and Gynecologists. My question's for Dr. Clancy. You mentioned the mini residencies, ensuring that providers have specific training to deal with the unique needs of this population. And I wasn't sure, is that for community care providers, or is it just VA providers? And if it's not for community care providers, is there interest in expanding that?
So right now it is just for our providers, but I would welcome more discussion as we think about working more effectively with our community partners, because we've gotten a lot of encouragement in that regard, particularly from the Commission on Care, which the Congress required us to stand up several years ago. So let's talk.
Thank you. My comment is for Dr. Clancy. Jackie Ruknovsky from the Association of Women's Health, Obstetric and Neonatal Nurses, and I'm also a veteran and a proud Navy nurse. And I want to just thank you. Your opening comments about telehealth and the VA and the progress that we've made with nurse practitioners providing care in the VA has made an incredible amount of difference to my friends, my colleagues, and my father. So thank you. And I just wanted to also ask for your continued support. I am on the task force of the Nursing Community Coalition, and I want to ask for the support for the Authority of Healthcare Providers to practice telehealth, ensuring that that authority is passed on to nurse practitioners and nurses in the Women's Veterans Program in rural areas, because we are stretched thin, and I know that it's a little bit of a gray area, and I appreciate your support. Thank you.
Well, I think we have a reg out. Crystal, is that reg still open for comment? We have been doing telehealth for a really, really long time, but because scope of practice and all that is a state regulation, we've tended to do it within states. So in Oregon, from the Portland VA, they've got a whole lot of rural veterans, right, that they can save a 3-hour trip by actually providing services in the veteran's home, if that's where they'd prefer. When we cross state lines, we run into some issues, so I would hope that your organization would comment on that regulation. Great, perfect, thank you.
Hi, my name is Tony, and I work with the Service Women's Action Network. We're a veterans organization that exclusively advocates for women in the military and women veterans. My question was for Dr. Clancy. So with the data showing that women veterans have a 250% higher suicide rate than civilian women, can you tell me a little bit about the specific ways in which the VA is tailoring their mental care to women?
So as I noted a few minutes ago at the tail end, just before Congresswoman Rivers showed up, one experience that I've had a lot as a primary care doctor is having patients who I thought needed some help from a mental health professional, variously described as a person with problem-solving skills or counseling, whatever the particular patient I thought could hear to start the conversation. But if you're not referring to someone that you know, if you are referring to a colleague, you can say, I know this person, I've worked with them, they're terrific. If you're referring to someone that the health plan found and you wouldn't know them ever because it's a whole separate thing, lots of people thank you for the conversation and never actually go the next step. So really, literally within the vast majority of our primary care teams aiming for all, we actually have mental health professionals right there. So you can literally walk down the hall and say, this is Allison, the person with whom I work. And she and I work together, helping veterans and so forth. And it makes that handoff a little bit easier. And 9 times out of 10, the veteran will take the next step. So I think that is one very, very important part of what we're doing in mental health, because we have, you know, research writ large is filled with studies of people who fail to have depression, anxiety, or other problems detected and recognized in primary care. Sometimes that's a detection problem, sometimes it's a follow-through problem. So we are trying to work on both ends of that. And we're constantly looking for ideas and have a whole team dedicated to what we can learn about research. I understand the CDC has a forthcoming report about suicides among active duty service members and veterans, whether they're enrolled with us or not, looking at factors that may be of increased risk. The other thing that I forgot to mention, and again, this is not gender specific, but I think really important, we have developed a statistical tool which helps us identify veterans at the very highest risk of suicide. So if you are a clinician taking care of one of these patients, you get a reminder so that we try to see and follow up with that patient a bit more often and more intensively and so forth.
Can I share a story really quickly? My colleague, my wonderful colleague, Tom, who's over here, and I met with Secretary Shulkin sometime over the summer to talk about women veterans. He, I should give him a quick plug here. He actually made time for a one-on-one meeting with IAVA to discuss women veterans. And in that meeting, he was very proud to share with me the statistic that if, when you're looking at patients who come in for mental health into the VA system, as she noted earlier, the VA does a really good job. In fact, when it comes to women, it's the only segment of the population where they actually improve the rate. So the VA does a better job than the private sector at saving women veterans' lives as it relates to their risk for suicide, which allowed me the opportunity to like reflect back on to the secretary that's why cultural barriers and attacking them is perhaps one of like the most pressing things that we can do. If we know that we can break down cultural barriers that are preventing women from wanting to go use the VA as their primary care provider, and if we can break them down, we'll save lives. Because the VA, once patients get in their care, they care for every veteran better. They have more cultural competency, they're able to coordinate care, we're investing in technology. And I think like if I want anybody to again, to underscore, I guess, my remarks, like to take away anything, like we have to be recognizing women veterans more, making sure that we're aware of them, and making sure that we're evolving a culture to make sure that not only America embraces them, but make sure that they want to and feel welcome in their own VA healthcare facility.
Please know you have my full 150% support on this.
Good to see Tom, who had worked on my staff. Actually, we are celebrating Veterans Day, or commemorating Veterans Day, and as I was listening to the discussion and the wonderful statements made of our people who make things happen, I thought about the fact that I'm on the American Battle Monuments Commission. This is a commission that oversees all our American cemeteries that are overseas. It's the kind of thing where you recognize that lives have been taken from them for freedoms of others. And this is the 100th anniversary. I mean, when you talk about Armistice Day, it's the 100th anniversary of the U.S. engagement in World War I. And one of the things that happened in World War I is that's where women were first involved. And that's when they came back and they had no jobs. Things have changed for the better, but a lot more needs to be done. But I can think about, when I think about the cemeteries, I think we all should bear that in mind during this period and throughout the time. I once spoke at Memorial Day, spoke at the American Cemetery in the Netherlands, where 8,300 burials, 1,500 on the wall of the missing, and every one of them has been adopted by a Dutch family. Every one of them with a waiting list. These people care about their freedoms and how Americans had fought for it. And so, and in a gender-neutral phrase by the first person who chaired the American Battle Monuments Commission, who was Buckjack Pershing, time will not dim the glory of their deeds. So just couldn't resist since there were no other questions.
Thank you so much, Connie. That's a perfect way to end this. It is always a privilege for us to host this event. And let's have another round of applause for our incredible speakers. You all do so much to improve women's health, and we thank each one of you for everything you're doing. And thank you again to all who have served in this room. And of course, thank you to the Women's Caucus leadership. And I do want to note that the first secretary of a federal agency in the new administration that the caucus met with was the VA secretary. So that lets you know, too, that these issues are at the forefront for them. And it was a very bipartisan meeting. And also, of course, thanks to our partners in the briefing, DAV and IAVA. And our appreciation, as always, to the Robert Wood Johnson Foundation for this healthy lunch and for underwriting this very long-term Women's Health Briefing Series. And last but not least, to the WCPI staff, Cheryl Williams, Sarah Placencia, Shannon Wilson, I see. There's Sarah and Emma Rogers, who may be outside. Oh, there's Emma, good. Thank you for making this briefing possible and all of your hard work. And happy Veterans Day.